Welcome to Endocrine Wellness. My name is Dr. K, and today we're going to talk about insulin resistance. The purpose of this video is for educational content only, and please discuss with your doctor for your specific treatment plan. How can we treat or overcome insulin resistance? So there are some modifiable and non-modifiable risk factors that contribute to insulin resistance. If you want to know more about insulin resistance and causes of insulin resistance, please refer to my other video on insulin resistance. So the non-modifiable factors would be genetics, getting to a certain age, being born with a certain ethnicity. Those are non-modifiable risk factors. But things we can do that are modifiable to lower the insulin resistance would be losing weight, being more active, quitting smoking, reducing our intake of sugar beverages. They're all measures to help lower the insulin resistance. So overall, when we look at diet, any food we eat causes a release of insulin from the pancreas. Among the different types of food we eat, carbohydrates cause the fastest and the robust increase in insulin levels, followed by protein and followed by fat. So fat causes the least amount of insulin release from the pancreas. So in a patient that is insulin resistant, this insulin release can stay high for hours and hours and hours before this would come down, contributing to all of the complications I discussed in an earlier video related to insulin resistance. The amount of food we consume also affects the insulin resistance. The more quantity of food we consume and the lesser carbs we consume with more protein and fat, there is less insulin release from the pancreas, which over time will help improve the insulin sensitivity and lower the insulin resistance. Exercise, usually a combination of cardio and resistance training, helps overcome the insulin resistance or improve the insulin resistance. When we move our muscles become more efficient at picking up glucose, at using the stored fat or glycogen for energy. As a result, we lower the insulin resistance, and in a way this contributes to weight loss also. So when we talk about exercise, I have to be very specific about this. It varies from person to person as what we consider as adequate exercise. So if I have a 70-year-old female with a few medical issues and wanting to lose weight or reduce insulin resistance, walking for 30 minutes is a good place to start. But if I have a young 35-year-old male that's significantly obese and significantly insulin resistant and says that walking 30 minutes is a way of exercise, that's not going to be enough for that person. They can start there at the 30 minutes of walking, but they would have to do more significant cardio and resistance training to overcome that insulin resistance. The timing of our food intake also affects insulin resistance. We're better off eating our food during the day than late in the evening or later at night, especially in an insulin resistant patient. When this insulin level stays high for hours and hours, we want that window overnight, at least for a 12-hour period, to give your body a chance to get insulin levels down, to get into a healthy metabolic routine. Based on the same concept, patients that are very insulin resistant also benefit by doing intermittent fasting, of course with your doctor's supervision. Intermittent fasting is not for everybody, but is very successful in patients that want to practice that. So the most common hours of intermittent fasting is 18-hour fasting with a 6-hour eating window. So the most common hour of eating window is usually noon to 6 p.m. and patients usually fast from 6 p.m. till the next afternoon. Usually black coffee or black tea or avocado, those don't break the fast because avocado is just fat, so it doesn't cause a lot of insulin release. So this fasting period of 18 hours causes your insulin levels to go down to really low levels, which allows your body fat to be used for energy instead of relying on the food that's coming in. There are also patients that do 24-hour fast once or twice a week to try to overcome the insulin resistance. Again, you would have to ensure you don't have other contraindications to do the 24-hour fast. You do have to really watch your electrolytes, watch your other nutrition while you're doing a 24-hour fast. So I would recommend discussing with your physician or provider before you try to do a 4-hour fast. Patients also do the intermittent fasting sometimes 5 days a week. They're able to do it during the weekdays, but not able to do it during the weekends, which is great. Any number of days you can do, that works just fine. There are also some medications that have been shown to lower insulin resistance and improve insulin sensitivity. Metformin is a drug we've been using for years and years and years for different reasons, but does help lower the insulin resistance and improve insulin sensitivity. We also have new class of medication in the last 10-15 years, the GLP agonists, which we use very commonly for the treatment of diabetes, but they also lower insulin resistance and improve insulin sensitivity. Although we do not have an official indication for using these medications for just insulin resistance without diabetes, we know that these drugs work in the context of insulin resistance. So some of these drugs would be like brand name Victoza, which is liraglutide, brand name Trulicity, which is dulaglutide, brand name Ozempic or Wegovy, which is semaglutide, brand name Mounjaro or Zepbound, which is tirzepatide. All these medications do help with weight loss, do help with lowering the insulin resistance, and do help progress the patient from a higher insulin resistant state to a lower insulin resistant state. These medications, especially in combination with lifestyle changes and exercise, really make a big impact with the weight loss and with lowering the insulin resistance, thereby reducing our future complications for cardiovascular and metabolic risks. Low carb diet and ketogenic diet can also reverse insulin resistance and overcome a lot of the insulin resistance related issues. So low carb diet, it can look different for different people. Usually for most of my patients start eating 50% of the carbs you normally eat and then go down to 30% of the carbs you normally eat, so that's sustainable for long term. Ketogenic diet is not sustainable for a lot of patients for long term. They do it for a short period of time, and if they can transition to a low carb healthy diet that they can do for long term, that's the most beneficial. Some patients are not able to do the ketogenic diet long term because it's hard to sustain and continue for the rest of their life. But we have very strong data showing both low carb diet and ketogenic diet can overcome even severe insulin resistance. But again, you would have to check with your physician or provider about your medications that may need to be adjusted when you start doing ketogenic diet or low carb diet, particularly if you're on insulin or other medications to treat diabetes, they may need to be adjusted. A lot of times with low carb diet and ketogenic diet, patients also lose weight so quickly that they may need modifications to their blood pressure medications and cholesterol medications, and they may need to make sure they're getting appropriate nutrition otherwise in terms of their minerals, so they don't run into deficiency situations. So if you are considering going on any of these diets, I would recommend discussing with your physician regarding your specific treatment plan and make medication adjustments before you start doing those. Also, again, exercise in combination with low carb diet and ketogenic diet does wonders for the insulin resistance. Because these fat cells, when a patient is insulin resistant, these fat cells are fat storing mode. So these insulin resistant patients have difficulty losing weight more than an average person that's not insulin resistant. So when they come to see me, they talk about how they've cut back their caloric intake, they're exercising, but they're not able to lose weight. They don't, because they have to lower that insulin resistance. They have to make sure the fat cells can see that the insulin levels are low, so your body can use up those fat stores for energy. So generally, a lot of these overweight patients or obese patients that are insulin resistant have a very hard time losing weight despite doing the regular exercise and diet. So that's why it's very important for these patients to address the insulin resistance, to take measures to lower the insulin resistance before they can be successful in losing weight. And that's it today. If you find this information useful, or you think a friend or family could benefit from this information, please share the video. Please like and subscribe to the channel. If you have any more questions on this topic, please email the channel and I will try to answer them as soon as possible. Thank you for being here.